Hello and welcome back to How I AI. In this special episode, I'm taking you with me to Biohackers World in Los Angeles. It's a gathering of innovators, practitioners, founders, and health pioneers exploring the future of wellness, longevity, diagnostics, and human performance. This two-day event brought together thousands of attendees, dozens of speakers, and a wide range of companies working at the edge of health optimization and emerging technology. I had the chance to sit down for a series of conversations that all pointed to something bigger. We are in a major transition moment in healthcare and personal wellness where AI is already being used to help interpret massive amounts of data, support doctors and clinics, personalized care, and in some cases catch life-threatening issues earlier than traditional systems might. In this episode, first you'll hear my interview with Paul Denslow. He's the CEO and co-founder of Intus Bio, the company behind GutID. We'll talk about why the microbiome might be one of the most important frontiers in health data. We get into the scale of the data problem, why the microbiome has been so difficult to interpret, and how AI is helping make the next generation sequencing and microbiome analysis more actionable for prevention and personalized care. After that, I grabbed a coffee with Dr. Stephanie Tran, the founder of Modern Human MD. She shares how her clinic is using AI-powered heart scans to detect dangerous blockages before they become catastrophic. She shares the story of a patient who used the scan and caught something that may have otherwise gone undetected until it was too late. I also got the opportunity to catch back up with David Korsunsky, the founder of Heads Up Health. I first interviewed him back in November at Biohackers World Miami. He shares what's changed at Heads Up Health in just the past few months. He breaks down what current research is showing about consumer adoption, physician usage, and why healthcare might be reaching a real inflection point with AI. And last but not least, I had a very candid and human conversation with Rory Montali. She shares how she built her AI clone, trained it on her own thinking, voice, and intellectual property, and how that tool has now become a real support system for her focus, decision-making, and also navigating ADHD in her business and everyday life. What I love about this episode is that it brings together both ends of the spectrum. You'll hear about advanced diagnostics, clinical use cases, and the future of AI medicine, but you also hear something much more personal. How this technology can support the way we think, process, and organize care for ourselves in real life. And a quick note before we dive into these conversations, they were recorded live from the expo floor, so you may hear some background noise throughout. That's part of the energy of being there in real time. I'm bringing you into the room with me. All right, let's dive into my first conversation with Paul now. We live in a time today where we can track everything, our steps, our sleep, and that might not necessarily be the answer to truly understanding our bodies. And it really raises the question of, are we collecting numbers or are we truly understanding the context of our data from our wearables and our personal devices? Today, I'm joined by Paul Denslow. He's the CEO and co-founder of Intus Bio, the company behind GutID. You might have heard of them when it comes to microbiome testing. And the microbiome is a key driver of health outcomes. Paul, thank you so much for being here. I'm so excited to host you today.
Thanks for having me. It's exciting to be here. Thank you.
Yes. So let's dive into that first point I just made on how we have all this data nowadays, and people might not necessarily be really understanding how to interpret it.
Data without analysis is pretty useless, obviously. Right?
Yes.
So you have to interpret the data and interpret in a way which is useful. And obviously, as we know, we've gone from sort of 2020, pre-COVID, post-COVID, we've gone into a world where we didn't do any at-home testing virtually. There was no wearables really of any real note, certainly not in sort of the mainstream public. And now there's a world where, I'm wearing a ring which is tracking, certain health data. For me, people are wearing smartwatches and so on.
Yes.
There's an abundance of data. And then what do we do with that data is obviously a key thing. And obviously the data that we look at is in the microbiome data. So it's kind of layers and layers and layers upon data. So I think getting the right data in the right fashion first, and then we start to build the tools, develop the tools to apply to that data to make it useful and actionable.
So how do you make your data useful and actionable? Say I'm a really active person who goes to test once a year, twice a year. What am I missing when it comes to interpreting my own data?
Yeah, I mean, there's obviously a bit of an open-ended question in terms of, well, what data are you getting? What are you testing?
Right.
What's the quality of test you're using for what you're testing?
Okay.
How do you prioritize what you're testing? So for us in Intus Bio and with GutID, we consider the microbiome to be one of the most important things to be testing, because ultimately the human body has 22,000 human genes. You've got 2 million bacterial genes. And these bacterial genes and the bacteria that has them in their genome are all mainly concentrated in the gut. There's multiple microbiomes in the body, such as skin microbiome, oral microbiome, and so on. But the gut is really the main concentration of bacteria and bacterial DNA in the body. And you think about that, you have 100 times more bacterial DNA than human DNA. Your human DNA is fixed. Your bacterial DNA can be changed.
Yes.
And if you ask most people, well, how much of cancer comes from inherited human DNA, people think, well, 50% kind of thing. But actually, it's less than 10%. And that makes sense because over 20,000 plus generations of humanity, DNA is pretty well optimized. Like if you had an ancestor who had a major predisposition to one disease or the other, then you wouldn't be here because that would have expressed itself and your line would have died out a long time ago. So human DNA is pretty well optimized. And this bacterial DNA, this bacteria in the body, is hugely important. We know it plays a role across a huge number of health outcomes, different cancers, other chronic diseases. And really, there's just a big gap of data. So we have great testing in other places. Human DNA is very easy to test for that. Bacteria, and a complete picture of that is very hard to test for. The technologies that have been available up until now have not done a complete job of that. And then Intus Bio came up with a brand new technology platform called Titan1. And it's a very good use case of AI because we have a new source of data, a new assay, a new test, a new platform, which is creating very high quality data. But then you have to have new tools, which thankfully in the age of machine learning and AI, we have very powerful tools to then interpret and make sense and analyze that data. So it's an exciting time.
What myths do you think there are around the microbiome?
One is that basically it's almost like mythical in its own sense. Like it's one of those things like it's so complicated or it's almost magical. We can't possibly track it, influence it, control it. It is what it is. And really the microbiomes are just a data problem, right? The Human Genome Project was a big data problem. We had to produce the data, analyze the data. The microbiome, because it has so many more genes, 2 million genes versus 22,000 genes like I mentioned, is a exponentially larger data problem. And so it took a new tools, which we developed at Intus Bio. My co-founder, Mark Driscoll, who actually played a role in the development of next-generation sequencing back 20 years ago. We have new tools, both in the chemistry, in the lab, the wet lab part, and then new analysis tools to prove that it is just a data problem. And people get very, sequencing is a very kind of like concept people get caught up in and don't understand, but it's actually very, very simple to understand.
Yeah.
A genome contains genes. Genes are made up of bases. Bases are A, C's, G's, and T's.
Okay.
And when it's in you, either your genome or the bacteria within you in the bacteria's genome, it's basically that data stored in a biological format. All that sequencing is converting it to a digital format. And so what's been happening historically, because there was so much data or so much bacteria to look at, the conversion of that biological to digital saw a big drop in the resolution of that data, the quality of that data.
Yes.
And so that's where Intus Bio came from, was to then have new tools, new technologies to make that conversion process very accurate. And so the first problem we solved for was generating high resolution microbiome data.
Wow.
The second problem we solved for was like analyzing that data to make it actionable and useful.
Incredible. Like you mentioned, there's so many rapid technological advancements with testing. How should someone approach with starting to test their microbiome health? Where do they begin?
Well, and excuse the plug, but go to GutID.com. So it's the first place to begin to test your microbiome. But basically, no, I mean, the key thing is to have a true microbiome test, you have to have a test which can see the entire microbiome, the whole ecology. Okay. If you go to the forest and you just count, 2 or 3 species of trees, well, how do you know if the forest is healthy or not? You got to see the whole forest, see the whole ecosystem, which is what's so unique about GutID. So start with a high quality test, and GutID really is truly unique, and then it has recommendations. It will tell you how to improve your score, how to improve your microbiome health. Start with that. If you have other testing programs, either do your own research to kind of bring that all together. There's some AI tools emerging now to kind of bring all that data together. Work with a clinician as well. They do have expertise in interpreting that as well. But we're very much a data and science-driven company, and we're giving people the data to then help improve their own health outcomes, either through fixing the problem they have now, and usually that's kind of through like gut function, IBS, things like that, or perhaps they're carrying problematic bacteria, which may only develop into disease over time. So being aware of that before you get the disease is kind of a key thing that we think about, so disease prevention.
Data really is king when it comes to AI. Can you share a case study of people finally being able to put the pieces of the puzzle together now that we have AI and all this data when it comes to the microbiome?
Totally. So that's a core part of what we do. So every sample in, and we have like gut microbiome samples, which are obviously oral microbiome samples. These samples generate 50 million data points.
Yes.
So if you then have a study for a certain disease, and we look at, we're very focused on pancreatic cancer, colorectal cancer, things like that, you're going to have hundreds, if not thousands, of patients that you're analyzing. So 50 million times hundreds or thousands means you're into billions of data points very, very quickly. And up until now, because we haven't had the high enough resolution data, we haven't had a chance to say, well, what is it? Is there something truly actionable that we can extract from these data sets to have a real tool, a diagnostic for disease prevention for certain diseases?
Yes.
So the power of AI, machine learning specific to us, which is a big part of what we do, is allowing us to decode the microbiome, decode the forms of dysbiosis, decode the bacterial profiles, which correlate or potentially drive certain disease outcomes.
Wow.
So again, given the number of data points that we're talking about, if we want to decode pancreatic cancer, we have to have dozens, if not hundreds, of pancreatic cancer patient samples at different stages of disease. We have to have hundreds, if not thousands, of control samples. You then have to look for through lines within the disease patients, which do not overlap with the control patients or the healthy patients. And then you're looking for both presence, i.e., hey, these bacteria correlate with the disease progressing or developing, and absence, because we find sometimes in the healthy people, there are bacteria which need to have protective qualities to also prevent them getting the disease. So without the power of AI, and AI is really truly fantastic at going through enormous data sets, this just wouldn't be possible. Without the quality of data that we're generating, this wouldn't be possible either.
Well, Paul, thank you so much today. I love the advancements of what's coming through. This is so empowering, and I'm excited to dive deeper with you and join your booth here. So thank you so much for your time.
No, thanks. Likewise. Thanks for having me. It was good fun.
Stephanie, good morning. How are you?
I'm doing great. How are you?
Wonderful. We are day 2 at the Biohackers World Los Angeles. Yesterday, I had the opportunity to come by your booth and try out some really cool health tech called ExoMind.
Yes.
And you and I were just talking a bit deeper today, and you shared a really exciting use case on how you are using artificial intelligence. So before we dive into that, could you share with listeners a little bit about yourself as the founder of Modern Human MD?
Absolutely, and thank you for giving me the opportunity. It's been just so nice having a coffee with you and chatting this morning in real time. So I'm Dr. Stephanie Tran, founder of Modern Human MD. We're excited to recently bring our brain health section to the office, which is known as ExoMind Santa Monica. So I'm a physician of over 13 years, board certified in family medicine. As a physician, I've been always looking at the different pain points patients have had, and it really frustrated me when I was a corporate physician that patients were really suffering out there and there wasn't really viable solutions for them in conventional medicine. So I founded Modern Human MD about 3 years ago to think outside of the box and to really help people to identify parts that they were struggling with. So overall mental wellness, heart health, and looking at their genomic blueprint to find ways of what exact medications do they need, supplements, and ways to ward off disease before it ever happens.
Fascinating. And so what really caught your interest to want to get into the advancements of health technology and bring you to the intersection of where you are now?
I think definitely just my own personal struggles as a physician and patient as well, trying to navigate the healthcare system where maybe you have a problem and then you have to wait weeks to months to get a diagnostic test, then another weeks to months to see a specialist, and then another weeks to months to even get a diagnosis to figure out what's wrong with you.
Right.
And I think that process overall is just demoralizing, and day after day ticks by of just feeling really cruddy, low energy, and kind of losing faith in the medical system altogether. And I think navigating for myself as a first-time now entrepreneur, business owner, first-time mom, it drains and takes a lot of your energy. And thinking now in my 40s, I'm like, gosh, I wish I had the energy of my 30s, and just looking for new solutions personally to benefit myself and my friends and family, and of course my patients, which is an extension of that.
Beautiful. We are all very like-minded here, and so let's dive into the biggest question today. How do you use AI specifically, if you could share the use case in your clinic that you use AI for? Yeah, absolutely. So we were really excited to partner with another third-party company to use AI heart scans for our primary care patients. So I'll give you a couple case study examples. I had a gentleman who was in his 50s, very active, swims every single day, goes on hikes, and has had asthma since he was a child. So he was reporting that during his swim, he was starting to become just a little bit more winded. And he was thinking, maybe we were thinking it was his asthma at first. So we increased his inhaler usage, and he's like, I'm still not feeling that much better. He didn't have the typical symptoms of heart disease that a lot of patients will exhibit, which is usually like chest pain or dizziness. Okay.
And so I said, you know, we're offering this AI heart scan that's non-invasive. You go into a machine for about 5 to 10 minutes, and it's going to take a look at your coronary arteries. So those are the two arteries that supply your blood with oxygenated blood. It's your heart's own blood supply.
Okay.
And then it takes a look at something called atherosclerosis, which is the plaque that builds up on your heart over time that leads people to later on have to have open heart surgery or even stents, which are very invasive and aggressive interventions.
Yes.
So we wanted to answer the question, one, does he need to be on a cholesterol medication? And two, was it maybe his heart that was contributing to his symptoms of the shortness of breath and interfering with his ability to perform his activities?
Wow.
So we went in, got the heart scan done. We got the results within a couple of days, and it showed he had a 98% blockage of one of his major vessels.
Wow.
So had he not gotten this scan and maybe another year went by, he might have just keeled over and passed away, which would have been shocking to all of us. We were able to get him into a cardiologist, get him a stent intervention, and now he's living his best life symptom-free and prevented a heart attack with the AI technology.
And how long has this technology been around? Is it newer?
It is definitely newer. It's been around for a couple years, but many people don't know about it, and it's not something that's offered in most primary care offices.
Right.
So most primary care doctors will only offer something called a traditional CT coronary calcium scan that only gives you part of the story, that only looks at calcified plaque, which actually is not the plaque that's responsible for causing a heart attack. It's a soft plaque that actually breaks off and then blocks the vessel from its critical blood supply. So this AI technology looks at both hard and soft plaque. It's able to quantify it to an exact number, and then it's also able to tell you if there's any critical blockages well before you have symptoms, so that you can be extremely proactive for your health, or if there is a critical blockage, to help me as a doctor navigate and get you into the specialist right away.
Wow, that's incredible. And so does it help you interpret it? Does it give a 3D scan? Like, what do the results look like when you go through the process?
Absolutely. It gives a very patient-friendly report that the patient can then take with them to their cardiologist, as well as for me as a doctor. It does a lot of different pictorials. So it does a 3D diagram where it actually shows all the vessels of the heart, and it color codes it based on if things are mild, moderate, or severe in regards to heart disease. And then also is able to capture your individual anatomy, and it takes a look at the actual blockage of the vessel.
That's incredible. I'm so happy we met today.
Me too. Thank you so much for taking the time and asking me about it. I hope more people know about Clearly, which is a proprietary heart scan we're using in our office and offering at Modern Human MD.
So if listeners want to reach out to you and get in touch, how can they connect?
Absolutely. The best way is through our website, www.modernhumanmd.com. We also have an additional website, dedicated to our brain wellness sector, which is www.exomindssantamonica.com, or they can give us a call here at the office. And the best number to reach us at is 310-315-0231 and get in touch.
Wonderful. And just my final question is, if people are not local to California, how can they find a provider that uses this technology that you do?
Absolutely. So it's through a third-party company called Clearly, Cleerly, and there are various providers throughout the United States who do offer these Clearly heart scans. So I really recommend reaching out to our office or looking up Clearly and a provider who offers this so that everyone can benefit from heart health and prevention.
Thank you, Dr. Stephanie. I really appreciate your time today.
Thank you so much. It's been so lovely chatting with you.
If you're tuning into this podcast, you're most likely an AI advocate, and you may have also wondered how to support your body against the invisible stress of EMFs. Think Wi-Fi, cell towers, or hours in front of your laptop. Lila Quantum products are lab-tested in triple-blind studies and are proven to help harmonize and neutralize EMF signals. Their products are the few things I felt a real energetic shift from. I personally wear their Quantum Energy necklace daily. And if you're someone who cares about optimizing your energy and nervous system like I do, explore their offers with my exclusive discount link below. David, so wonderful to see you again at Biohackers World Los Angeles.
Yeah, the follow-on from our last meeting in Miami Beach.
November.
Yeah.
Yes. November was not that long ago, but in AI and tech, it can feel like a very long time because things move so quickly. I love this opportunity to catch up with you. I didn't get a chance to attend your talk this morning, but I would love to hear what's happened since we last spoke. I know you had some things to share about the agentic marketplace, how healthcare clinics and individuals are adapting this technology and reacting to it and integrating it. So if you can touch on those and anything else that you feel like listeners would want to know or learn from all you've been up to with Heads Up Health in the last handful of months.
Thanks. Well, when we talked in November, as a company, we were just starting to rebuild Heads Up as an AI native platform.
Yes.
All of the data is connected to a large language model. So we're now here into March. So we've made a lot of progress on the development of our system. And perhaps the most exciting piece is that we've now got our first custom AI agents running inside of medical clinics, automating some of their hardest problems, and also some of their most mundane, repetitive, trivial things that can be automated and give everyone in the organization back time. So the more customers we talk to, we start to see patterns. And then when we see patterns, we build the software. So the exciting part for us is we have our first real AI agents in production helping doctors. Huge step. In my talk, I presented a few updates. One was an update from Rock Health. Rock Health is one of the longest running analyst firms in this industry.
Okay.
And they've been publishing industry research on digital health trends for 10 years. And they did a survey of about 8,000 consensus managed people about their attitudes towards AI as an individual patient, independent from the doctor. And they found that 1 in 3 are already using an AI tool for their health.
Great.
So about a third of the people surveyed. They found that ChatGPT was the most popular platform. Of the people using it, they found that 60% were using it at least once a week, sometimes more. Consumers are going all in here already because it's really helpful.
Yes.
There was some real objective data on 8,000 people and published research. So I showed some of the results from the Rock Health report.
Okay.
And then I showed some data from the 2025 Physicians AI report. And they did a similar study, but only doctors. And they asked doctors about their attitudes. The adoption was even higher. About 64% of doctors are using it every single day.
Wow.
So about double the consumers. The biggest frustration for the doctors is that their employers, the hospitals and the health systems, are very bureaucratic.
Yes.
They're very security sensitive. So even though the doctors want to be able to use this in a clinical setting, the organizations are very slow to move. So this is helping doctors, but it's moving too slow, was the general feedback from the clinicians.
Okay.
I shared an update from the FDA, announced earlier this year in Las Vegas at the Consumer Electronics Show, fast-tracking improvements for AI-powered tools and diagnostics. My summary was, we've got a rare moment in technology where it's coming bottom-up from the end user, top-down from the FDA. The doctors are on board. So it's just coming at all levels very, very quickly. So it's moving fast.
Yes.
People are excited about it. I shared a quote from one of the doctors in the Rock Health study. He was from UCSF,
Okay.
and he was cited in the Rock Health report. He said, our healthcare system is fundamentally broken. I'm cautiously optimistic about AI. There's nothing else we have that can help with this many things so fast and so effectively. So he basically said, this is the biggest experiment in human history around healthcare. We don't exactly know how well this is going to turn out, but we have a broken system, and this is our best shot.
Is that study public? Can I share it?
Yeah, the Rock Health 2025 Consumer Health Adoption Report.
Okay.
And just Googling that will pull it up.
Great.
And if you want the exact link, I can send it to you.
Wonderful. Well, thank you so much for catching me up. It was great to run into you again
Me too,
and
bro.
see all the continued success with Heads Up Health.
Thanks. Great to see you again.
I'm here with Rory Montali. We're going to do some interesting work around craniosacral therapy, but before we get into that, I'd love to hear how you support your business with AI.
So I have a clone. I have a clone that knows me inside and out, and it's a special project that I put in all my instructions. Recently, I just put in that I'm having some ADHD and focus areas, and now they're working with me a different strategic plan, and they keep me in such a way that knows me more than anyone, because when I say, well, do I want to add this to my plate? They go, oh, it's in alignment, and this is why, and this is how we're going to incorporate it, and I love my clone.
Where did you build your clone?
I did a program with Tony Robbins and Dean, and they had as an amplifier club thing that they were doing. They went in and they explained my intellectual property of me, where I downloaded all my projects, and it strategically tells me how to function, like what works for my brain for the morning, and it'll tell me what affirmations that will be good for me. It will call me out when I say I'm not doing what I'm supposed to.
A lot of people are throwing around this term neurodivergent. How has AI supported your ADHD?
First thing I would say with ADHD is to get diagnosed not by just someone telling you your symptoms. Do the actual physiological testing to see if the eye pattern could press the button to see how long you tune out or tune in. So there's two parts of ADHD. I'm only selective, I'm not both, right? So that means I could pay attention, and sometimes if there was like, I'm here with you, but then the dog is barking and the sirens are going off, my nervous system would be like scattered and it wouldn't be able to just be here and be in reactive.
Yeah.
So with the ADHD now, and I'm so blessed to know I worked on it just this past week. I went to an investment conference and all my clients were there, and then I called my clone and I went right to my clone. Clone, I want to start a group called True Connect. Or can you help me with the name? Can you help me with the image? Can you let me know what my mission is? And right there and then, 4.5 seconds, we had 13 people within an hour and 10 minutes.
Wow.
So my clone is like that on an instant. Hey, I got this idea. They'll say, okay, bring a sign-up sheet today. When you're getting interviewed, please invite people on your WhatsApp and get them the UR code.
Yeah.
So they made me a UR code. And they made all of my social media on 4 different social medias on one page. So anyone can reach me at any time. I love my clone.
I love interviewing, especially women, on how they're using AI in such an empowering way, and also there's always a ripple effect in our communities.
And I would love to get your audience codes to so many resources. So True Connect is just the True Connect on WhatsApp.
I'll add it in the show notes. So thank
Show
you.
notes.
Thank you so much, Rory.
I hope you enjoyed this special episode from Biohackers World in Los Angeles. If one of these conversations stood out to you, I'd love to hear about it. I'll link the resources and reports mentioned in today's episode in the show notes so you can explore them further. And if you're hosting a conference, live event, or panel and want thoughtful media coverage, curated interviews, or a moderator who can translate complex innovation into a grounded human conversation, feel free to reach out to me. And if this episode gave you a new perspective, send it to a friend or share it with someone who is curious about where AI and health are headed. And make sure you're subscribed so you don't miss what's next. See you on the next episode. I hope today's episode opened your mind to what's possible with AI. Do you have a cool use case on how you're using AI and want to share it? DM me. I'd love to hear more and feature you on my next podcast. Until next time, here's to working smarter, not harder. See you on the next episode of How I AI. Have you just started exploring AI and feel a bit overwhelmed? Don't worry, I've got you. Jump on a quick start call with me so you can walk away with a clear and personalized plan to move forward with more confidence and ease. Join my community of AI adopters like yourself. Plus, grab my free resources, including the AI Get Started guide, or try my How I AI Companion GPT. It pulls insights from my guest interviews along with global reports so you can stay ahead of the curve. Follow the link in the description below to get started.